The day after her assessment, Emily starts her PHP program. She reports to the Linden Oaks office, where she gets oriented to the program. Emily starts attending group therapy sessions several times a day and starts having individual therapy sessions with her clinical therapist. Emily works with her treatment team to develop treatment goals and plans. Her number one goal is to return to school, which she really enjoys. Emily also starts tutoring at Linden Oaks, where she works with a certified teacher for 1 hour a day. The teacher helps Emily develop a plan to keep up with necessary assignments and tests. Linden Oaks remains in contact with her school regarding her schoolwork. During this first week of treatment, the clinical therapist asks Emily and her mom to sign the clinical ROI for Emily's school, which allows Emily's clinical therapist to communicate with her school about Emily's treatment. This allows Emily's clinical therapist the ability to call her school social worker and to let her know that Emily has started PHP and how her treatment is going so far. The clinical therapist will also talk through any schoolwork issues for Emily. Within the first week, Emily also has a full psychiatric evaluation with a psychiatrist who starts her on an antidepressant. During the second week of treatment, Emily really starts to become engaged in treatment. She likes her clinical therapist, and animal-assisted therapy is her favorite group to attend. She also begins to use skills to manage her depression. At the end of week 2, Emily has a family session where she meets with her clinical therapist and her mom. They decide that Emily is ready to have a school transition meeting with her school and Linden Oaks to discuss Emily's transition back to school. The day after her assessment, Madison starts treatment. She reports to the Linden Oaks office and gets oriented to the program. Madison attends group therapy and individual therapy with her clinical therapist. She develops treatment goals and plans with her treatment team. However, she's still reluctant to return to school. Madison also starts tutoring at Linden Oaks. After she mentions an assignment she can't find, the Linden Oaks teacher contacts her school to obtain the assignment. During this first week, Madison and her grandma are asked to sign a clinical ROI for Madison's school, which would allow Madison's clinical therapist to communicate with her school about the issues she's been having with returning to school. However, Madison's grandma opts to not sign the clinical ROI as she doesn't want the school to know any clinical information. Madison's clinical therapist calls her school counselor to let her know that Madison is at Linden Oaks. However, Madison and her family have opted not to sign the clinical ROI, and so Linden Oaks will not be able to provide clinical information and will be communicating with the school on schoolwork only. In the first 2 weeks of treatment, Madison's team notices that Madison is reluctant to open up in group sessions. While she does attend, she doesn't participate a whole lot. Madison does like art therapy and makes progress working with the art therapist. She also starts to learn some skills to manage her anxiety. At the end of week 2, Madison has a family session where she meets with her clinical therapist and her grandma. They decide that Madison is ready to have a school transition meeting with her school in Linden Oaks to discuss her transition back to school. The clinical therapist asks Madison's grandma to sign the clinical ROI again in order to share skills Madison has been working on. However, they opt not to. The day after his assessment, Jake starts his PHP program. He reports to the Linden Oaks office where he gets oriented to the program and the group therapy schedule. Jake starts attending group therapy sessions and begins his individual therapy with his Linden Oaks clinical therapist. Jake works on his treatment plan with his clinical therapist. Jake doesn't think his marijuana use is a problem at first, but is willing to abstain from using and participate in group. He is willing to work on his relationship with his dad. Jake starts tutoring at Linden Oaks for 1 hour a day. The teacher gets the schoolwork from Jake's dad each day and begins to work on assignments with him. The teacher communicates any schoolwork issues to Jake's dad. During the first week of treatment, Jake and his dad are asked to sign the clinical ROI. They opt not to sign given Jake's previous issues at school and do not want Jake's school to know he's in treatment. Jake's clinical therapist is unable to call Jake's school at all. At the end of week 2, Jake has abstained from all substances, and Jake and his dad attend a family session at Linden Oaks. They decide they are ready to discuss Jake's transition back to school. Jake's clinical therapist asks them to consider signing one or both ROIs again to help facilitate Jake's return to school. However, they opt not to again.